Hi everyone, my name is Farana Belgrave. I am the Division Administrator for the CP Center, and I would like to welcome you all to this evening's meeting to greet with Dr. Selber and team. Tonight you are going to meet Dr. Selber, Jen Moskowitz, who is the social worker for the CP Center, myself, Farana Belgrave, Belkis Tavares, who's our administrative assistant, and Christina Coleman, who is our communication and marketing coordinator. To get things started, I would like to introduce Dr. Selber.
All right, and I took off the screen so we can have full videos of everyone. So Dr. Selber, you can go ahead and unmute and introduce yourself to everyone.
Well, first of all, thank you all for organizing this, and thank you all who are seeing this today and spending your time with us. It's actually an honor and a privilege for me to be here. I also have to say that I'm not from Hollywood. I'm a hillbilly from Brazil, and I'm not very good in front of cameras. But my story is I'm Brazilian. I'm an orthopedic surgeon, and since the very beginning of my career, I wanted to treat people with cerebral palsy and other diseases such as cerebral palsy. I trained in Brazil, in America, and then I went back to Brazil. Then I was invited to go to Australia, and I spent the last close to 20 years in Australia. And then Colombia invited me to move to New York, and they charmed my wife and my two daughters, and here I am. And it's been a very interesting and very good challenge for me to move from Australia to the United States. I love it. I already started loving my patients here. Patients are the same anywhere I've been. You treat them well and honestly and directly, and they like you. And then we start a good relationship. I've been here for around 18 months now, and we're gradually rebuilding a practice that I've been doing for nearly more than 25 years. So I welcome you all who think I can help you in any way. I'm not a very formal doctor. I like to I like to be just myself with my patients. This is a long-term relationship that we create, and it needs to be professional, but it needs to be humane and friendly and fun and nice at the same time. And that's what I try to do with my patients. Thank you so much.
Great. Jan, you want to go ahead and introduce yourself?
Sure. Hi, everyone. Good to meet some of you. For those of you who I know, good to see you again. My name is Jan Moskowitz. I'm a licensed clinical social worker and psychotherapist here at the Weinberg Family CP Center. So basically that means that I provide individual psychotherapy, which is basically talk therapy with our patients and some family members. I also facilitate a monthly support group as well as co-facilitate PFAC, which is the Patient and Family Advisory Council. And the goal of that new group is really to help enhance the patient experience from the patient perspective. So my goal really is to support all of you in whatever you need, both in terms of concrete services as well as mental health. I've been at the center for a little under 3 years, and I'm really looking forward to Dr. Selber being here. We've been collaborating really well, and really just kind of building this practice and building this center to be the best that it can be. So thank you all for joining us, and I hope to see you guys post-COVID in real life sometime soon.
Thanks, Jan. Belkis, you want to go ahead and introduce yourself? We'll come back to you, Belkis. Farana, let me go ahead and shift over to you, and I'll share my screen because I know you have some PowerPoints that you wanted to share.
Thanks, Christina. So as I mentioned earlier, my name is Farana Belgrave, and I'm the administrator for the CP Center. And I've been with the center for a little over a year now, but with the institution for over 8 years. So My goal here with the center, as with any other practice with our university, is to one, promote patient care, and two, to make sure that the experience is absolutely wonderful from the minute you schedule your appointment to the minute that you are seen in the office. So our goal is to really make sure that we provide comprehensive and a really positive experience for our patients. I wanted to just share with you just our practice locations where you can see Dr. Selber. So we see patients at our main campus at the Children's Hospital, which is 3959. And we also see patients at Herbert Irving, which is where most of our adult patients are seen that want to come to the main campus. We also see patients at our Tarrytown location, Bronxville, and of course, we also offer telehealth appointments to any patient that's interested in seeing our provider and our team virtually. So, to those of you that are interested, we are going to have our contact numbers up for you briefly. But I also wanted to just jot down for everyone here and make note of that when you come in to see Dr. Selber, you will also be greeted by our nurse practitioners and our nurses on our team. So our goal again is to make sure that when you come in, you get a comprehensive care plan for your visit, and that we can help navigate your care as we help you with your clinical care. Um, Here is our contact information where you can reach out to us. So for those of you that are looking to schedule an appointment with us, you can reach us either at this 212-305-2700 number, or you're welcome to email us. And for those of you that have general orthopedic questions, you can also call us at 305-4565 or email us at the email provided below. And this is just additional numbers for any providers that are listed here. Please reach out to us at 212-305-2700, option number 3. And of course, we wanted to also provide you with an additional number for more direct service, which is 212-305-5253. This is the center's email address where you can get more information about who we are, our practice, our providers, our locations is all listed there. And you'll also get some information about our research, and there's some videos about patient experience and some testimonials that you can read up about as well. And we are also sharing with you our department orthopedic site as well for more information.
Awesome. Let me see. Belkis, I don't know if we've gotten you back yet. If not, I'll just expand in the meantime that the website for the CP Center also has resources for the community, anything from adaptive sports to physical therapy at home to any sort of wide range that you're looking for. And then both websites have more information in the phone numbers and things that we listed before, and we'll also email those out after, so you didn't have time to jot them down. We can go ahead and send those after. And then, so it looks like Belkis is not able to connect, so we can virtually, oh, can you hear us?
I can, I'm having problems with my camera, but good evening, everyone. My name is Paulo Selber. I am the administrative assistant and surgical coordinator at the CP Center. I've been with the CP Center since the very beginning. We would say in 2012, we were trying to get the center together, and we inaugurated in 2013. We are here. If you need any help, I mean, we're just a phone call away. Hope to hear from you soon.
Awesome. Thanks for that, Belkis. I'm glad we got you. Let me just share back my screen real quick. So just to finish things off, this was just a casual meet and greet. I know a lot of people were patients of Dr. Roy's before, and maybe you haven't met Dr. Selber yet, or you are waiting till after COVID to come in, or you want to schedule a telehealth. And sometimes just putting a face to a name makes things a lot easier. And then also for our providers that are on here, we would love to reach out with you and make the connection for Dr. Selber's practice now that he's up and running. So at this time, we'll collect questions and answers. I saw a few come in. Let me minimize my screen again so you can see everyone's faces. So you can put those in the chat, or you can put it in the Q&A, but I'll go ahead and start with what we've gotten so far. So Dr. Selber, for you, This question is, what are guiding principles that you use to provide care?
Well, in this field, and that's the side of this field that is my passion. The first thing is that we have to be able to create long-term relationships, because, as you all know, cerebral palsy doesn't go away, and the stubborn legs sometimes are there for a long time, and we're always trying to help and do more things. I think the principles that I follow are, I always tell the patients everything that I know and everything that I don't know. And despite the fact that I've been doing the same thing for more than 25 years, that's all I've done in life, is to treat patients with CP from the orthopedic perspective. There's still lots of things that I don't know. And when you don't know, you ask your senior colleagues and you discuss with your colleagues and come up with a good solution. So as I said at the beginning, I think this relationship needs to be professional, but it also needs to be a nice relationship, one that the patients come to us and say, okay, I saw someone who really cares about me. And I think that's probably one of the few things that I'm proud about my career, is that I think in the majority of the cases, I think patients realize that I care for them truly, and I really, really love what I do. Sometimes I talk too much in consultations, and I'm constantly a little bit late to see the other patients, but then the other patients are never mad at me, because they know that when I'm seeing them, I also pay attention to what they want to say, and we discuss at length. So I think an honest and nice relationship, professional relationship, is what we need in this field. And that's what I've been practicing over the years.
Thank you. Farana, we actually have a question for you. Will you change up the waiting room for clients who are young adults post-COVID? Make sure you unmute.
Thank you. I always forget to do that. We're in the midst right now of doing some minor renovations to our waiting area. So when you come back for a visit, you'll see that we've changed like the paint colors. We have actually put in some ADA double doors for our patients. And so I'm open to any suggestions in terms of what you would like to see in our waiting area. And I'm happy to do anything within reach and limits.
Great, thank you. Okay, Dr. Selber, this is for you. Someone is already a patient of Dr. Azizi and sees her 2 times a year, but lives in Florida. She's interested in your specialty in gait analysis. Can you explain more about that?
Yeah. Well, I was trained by one of the fathers of modern gait analysis, Dr. Jim Gage. And my career has always been about treating people that are walkers, but also the non-walkers. So with those people that can walk, whenever we think there's a chance that we can improve the way they walk through surgeries, and sometimes other treatments, Botox, physical therapy, and so on, the best and most precise way that we have to analyze the way they walk is through what we call three-dimensional gait analysis. So I use it intensively, and I very rarely indicate surgery without gait analysis. What is gait analysis? Gait analysis is a scan of how people walk or how people move in general. So it gives us a lot of information about how they're walking, what they're using to walk, which muscles are working, sometimes not appropriately, sometimes too much, whether the bones are well aligned, because we know that in CP, as people grow, the feet sometimes are not in the same direction as the knees are pointing in, and there's a lot of problems. So when we do gait analysis, we can understand very precisely what can be done to change. But not only that, when we do gait analysis, we have a measure of how they're walking. And then when we do interventions like orthopedic surgery, and if we repeat the gait analysis after a year, after 2 years, 5 years, we know, and that's what we've been doing for the many years that we've been in this career, is to see and prove that, that what we're doing is working. So gait analysis serves us to help us decide what to do about the patients to try and improve the way they walk, but also it's our checkout points in terms of, okay, have we done good for this patient? So we send them back to the gait lab after a year or two, and we reanalyze the gait, and we can see the changes, what worked, what didn't work. And so that makes us learn also. You know, I've been learning from gait analysis for 25 years, and I learn all the time still.
Great. And I think off of the gait analysis, we had a few other questions. One being, is it available right now during COVID? Can it only be done in person? So those were two questions specifically, if you could answer those, Dr. Selber.
Yes, it is available right now. We continue to do gait analysis, and it has to be done in person. You know, it's a very complex process. It's actually cool. Don't be afraid of it, because it's actually cool, and even the children love it. But you have to go to the gait lab, and you're going to spend 2 or 3 hours there to collect the data. Some kids say it's a bit boring, but it's actually, I try to convince them that it's not all that boring. And it's available. We've been sending patients to the gait lab since I started my practice here, as I have always done. You know, I've worked so far with, I think, 8 gait labs in the world. I've set up 2 gait labs, one in Sao Paulo in Brazil and one in Sydney in Australia. So my life is all about gait analysis. I don't operate on patients very often without gait analysis. And I don't think anybody should have orthopedic interventions without gait analysis, primarily the more complex ones.
Great. Okay. And then we had some questions come in about specifically for orthopedics. Who do you see and you know, what specialties and what parts of the body do you take care of?
Yeah, that's a good question. So I see everybody who has CP. I see people who have had strokes and head injuries and spinal cord injuries. I see people who have other diseases like spina bifida and other muscular diseases that compromise the ability to move. But I specifically I specialized in fixing the lower limbs. So I've been fixing or improving things for the hips and knees and feet. When it gets to the spine, I have to be rescued. You know, I send the patients to a spine specialist, and upper limbs as well. I don't do upper limbs. You know, after 26 years, you learn quite a few tricks, and you know more or less what to recommend to the patient in terms of where to go, who to see. But I treat from the hips down to the feet.
Great. Another question, one is, first and foremost, thank you for treating adults with CP, exclamation point. So what is your advice for maintaining function as an adult and maintaining strength as an adult between appointments?
Well, that advice, I don't, and I hope you all understand me, is I don't think CP is different. They're just human beings like me that have stubborn legs. And I hope this term stubborn doesn't offend anyone. The kids love when I call their legs a little bit stubborn. They see themselves a little bit as rebels and say, yeah, that's what I have. My legs are a bit stubborn. So how do you keep yourself fit? The same way as anybody else. You know, try to keep your weight down as much as you can. Be active, do exercises that are, you know, that you are able to exercise with. You know, I think when people become adults, I think they should go to gyms and liaise with their orthopedic surgeons or the rehab physician or the physical therapist, and find ways to be active in exercise in ways that are attainable within their own cerebral palsy. And you always find someone who wants to help and someone who wants to liaise with us, you know, a personal trainer or somebody like that. that we say, okay, this patient, we can't stretch that muscle too much because that muscle is a bit too stubborn, but we can do these and that and the other. So in resume, be fit, don't put on too much weight, please. And I know that that's hard, and it's hard on all of us. And try to keep moving, because as they say in orthopedics, movement is life, life is movement.
Thank you. Jan, we actually have a few questions for you. One is, can you talk about support meetings someone might have heard of and the support groups? And then also, do you know about any link between anxiety and CP, or how our muscles affect anxiety?
Sure. So first off, I'll talk about support groups. As of right now, I run one support group for young adults with CP. The group currently, we're currently at capacity, but I am looking at expanding and starting new groups once I have a little bit more staffing support. Right now, it's just me. I'm doing my best, but I do hope to expand in the near future to older adults with CP. I would love to do some group therapy and some teens with CP. So that should be coming down the pipeline, hopefully sooner than later. And thank you for the person who asked the question about anxiety. Is there a direct correlation? Yes and no. There's no set research saying that having CP increases anxiety. However, there are, as we know, and you guys as the experts know, that when you have a physical disability and there are more innate barriers to life and travel and mobility and access and working and all these things, that yes, anxiety can come hand in hand. It's kind of a chicken and the egg kind of situation. I'm not sure that one causes the other, but it is quite common. Then again, I like to tell people and normalize the idea of mental health, that we're New Yorkers, and to be in New York is to be anxious. So join the club, and I'm here to help.
Thank you, Jan. I have a two-part question that I'll start with you, Farana. It's about telehealth and how that's working.
Yeah.
If you could go ahead and start
So,
with that.
Telehealth has really been amazing, especially in the midst of this pandemic. We're finding that for our patients that are just not ready to leave the house yet, their guards are high, this has been like very instrumental in how we deliver care. So we've gotten really positive feedback with our patients and our providers, and we're constantly encouraging our patients, like, don't be scared to come into the office. But if you don't want to come into the office, telehealth is a great option. And Belkis and my team were prepared to walk you through the steps on how to schedule an appointment. We're prepared to walk you through the steps how to navigate your appointment. So for those of you that are timid about it, please reach out to me directly, either via email or through Belkis, and I'm happy to share as much information as I can about telehealth for you. And we've also just recently just updated our website portion about telehealth. So there's lots of information about how telehealth is taking place, how we're doing it. So please don't hesitate, reach out, tap into telehealth. I think it'll be a great resource, as it has proven to be already for our patients.
Great, thank you. Part two is for you, Dr. Selber. With telehealth in mind, how is that working for a patient that might, walk up and down the hallway during an appointment? Is that taking place via telehealth, or what is that looking like?
Yeah, that's a very, very smart question. Thank you for that. So what we're doing, I love telehealth because I really like to talk to patients. I really do. And sometimes I talk too much, and you guys can cut me off if I'm talking too much. But I like to get to know them well, and I like to explain things to them. So a first consult through telehealth gives us the opportunity to introduce each other. I can see the person. I'm trying to start to understand what's going on, and the patient also looks at me and says, "Yes, this guy seems to know a little bit, or I like him or I don't like him." So it's a good way. And for me, that I've moved from Australia to here, every patient to me here is a new patient, as opposed to Australia, where I had known them for years and years and years. So telehealth helps us to start that bonding. And then if the patient is far away, or if the patient is not prepared to come here yet, I always ask them to send a video to me. They send the video to Belkis, and it's a video that, they shouldn't include their faces, and it doesn't need to be Hollywood production. And I can see them walking through the video, and then I normally get back to them. Then what happens is, if I feel comfortable that the video has told me everything that I need to know, then we schedule a second televisit, and we discuss it. But doctors, we like to see, to watch, to examine again, to see again, and to watch again, and so on. And so telehealth is an excellent means, and it's here to stay. And I'm so glad that it's here to stay. But eventually, depending on the kind of problem that we have, we'll need to see you in person. But very quickly, I'll give you an example. I saw this patient the other day from Midwest, and he had a problem with his knee, and he went to an orthopedic surgeon who doesn't know CP, and the orthopedic surgeon said, "Okay, we need to do an operation." So he panicked. So we consulted, and I said, "Okay, send me your imagings, your MRI of your knee, and I'm going to talk to my knee specialist here at Columbia." And so I went to this guy that I trust here, and I said, "What do you think about this imaging? What do you think about this knee?" And he said, "Yeah, I think it needs surgery." And I said, "Okay, would you be kind enough and talk to this patient?" And so then a telehealth consultation is booked with this guy who is a specialist in knee for adults. And they discussed it. And guess what? The patient felt more confident. He went back to his local doctor. We knew that this guy was doing the right thing, and he really cared, and he had the surgery, and he was getting better. So this is I think it's a wonderful, true example of how telehealth can help us when the patient is. And I was so happy and so proud that I could help this guy from a distance, and that we went through. And then, of course, once he had the surgery, we continued to talk about rehabilitation, what exercise he could do, and so on. So it was pretty cool.
Awesome. Thank you. Farana, I have a question for you. For some of the referring providers that are on the call, is the best next steps for them to just call the phone number we gave earlier, or what would you suggest?
I definitely recommend that you call the 305-2700 number and press option 3. And that will get you Belkis on the phone, and then Belkis will help navigate either scheduling an appointment directly with your patient, or we'll just do some basic intake on how to get your patient an appointment. But that would be absolutely the best number to call and reach out to the practice.
Perfect. And then we do have some insurance questions, Farana. And, is Gait Analysis covered by insurance? If I don't have insurance that Dr. Selber sees right now, what should I do?
Those are really awesome questions, and I actually saw them in the chat, and I tried to respond back to as many of them as I could. So insurance is very specific, as everyone knows, and can be very challenging. But what we do on our end is we really take our time and we review each patient's benefit. So that would be the first initial thing to do. We'd be like, come in, see Dr. Selber, see, and then we'll go over your benefits, call your insurance plan, see what you qualify for, and then we can take it there. No one plan is the same. There's very specific information for each plan. But our goal is to work with the carrier to get the services that you need to be covered. So if that means Dr. Selber getting on the phone with a peer-to-peer or writing a letter of medical necessity, we're prepared to take whatever additional steps that we need to do to make sure that we can get this as a covered benefit for you.
I just would like to compliment, so that there are a couple of insurances that we unfortunately we tried all channels to get them to approve Gait Analysis, and they're not doing it, which is unfortunate. But I think in the future this has been a long battle. You know, gait analysis is not a new thing. It's been around for, I've been using it for 25 years, as I said to you, but it's been around for close to 40 years. I think this situation will gradually change as more of us push for it. And but sometimes I must say that we tried everything that we could since I moved here, and the insurance company just said no.
I know we're running short on time, so we're going to, thank you to everyone who attended, and we're going to keep on and answer a few more questions, but we understand if you have to go. We appreciate your time and getting to know us a little better. So just wanted to let you know, and we'll send an email out with information afterwards, but we'll stay on for a little bit longer to make sure we get through these questions, but just wanted to be mindful of everyone's time. So feel free to stay on if you can. If not, we totally understand. So let's go ahead and go to another question would be, how often should CP patients book a visit for best regular care, Dr. Selber?
Yeah, that's a good question. Thank you. Look, I think it needs to be tailored. When children, for instance, are growing, and they do grow, we sometimes need to see them a little bit more often. So I like, depending on how involved or not so involved a child is, I like to see them once or twice a year. And sometimes when you're an adult, and an adult is doing well, and they come to me and say, look, I just came to see you because I want to be sure that everything's all right, and we check and we chat and we talk about what's changing, what's not changing. I tend to see these patients once a year, sometimes once every 2 years, depending on how they're going, of course. And of course, this is never a static decision, because we all age, and things can change with anybody. So I always say to my patients, I say, look, I'm going to see you in 18 months, for instance, but if there's any issues or any concerns, obviously you just ring in and I'll see you anytime earlier if something changes dramatically, or drastically or suddenly. So it's not one number for everyone. It's very, every patient is going to be a bit different.
Awesome. So speaking of each patient being different, we had a question that came in, what are the main differences you see between children and adults with CP?
The children are cheekier, and I love the fact that they're so cheeky. And children tend to mend faster when we do operations. So we become more selective and way much more, how would I put it? In adults, and depending on the age, things that we would clearly indicate in a child, we sometimes don't do them in adults, because we know we run into many complications, and we just say, no, you do have this problem, but I'm sorry, orthopedically speaking, I don't think it's wise to correct this. And this is as hard as, in fact, for us, it's harder when we have to say, no, I cannot improve this. So in children, we have a lot of experience with children in the last 30 years through Gait Analysis, and we learned a lot, and we changed, not only me, but my predecessors. We changed the way we treat CP these days. Unfortunately, there's still a lot of people out there that continue to do surgeries that we not even use anymore. But so when it gets to the adults, we need to be more careful, because it takes them longer to rehabilitate. They have work, they have families, so we need to compute all of these things. So I think adults are a bigger challenge than children. And I like that. I've been trained to see adults since my very first training, because when I started my career in Brazil, the institution that I worked there, called AACD, Association for Assistance of the Disabled Child. They used to see adults as well, because they knew already, this is more than 30 years ago, that if they discharged the children wouldn't have anywhere else to go. So I was lucky because at AACD, we saw the adults. And in Melbourne, in Australia, I did the same. I continued to see the adults. Adults are more challenging in a way, but on the other hand, they know what they want. And if I tell them it's going to be hard, and they say, yes, I want to go through it, it's easier in that way.
Thank you. Let's see. One question was from earlier about the telehealth visit with you. Should they video themselves before their first telehealth meeting with you, or is that done after their first meeting with you?
I think it's better to do afterwards, because sometimes we don't need a video, because you can show me the foot and the foot is a bit stubborn in a direction or not, and I can say, yeah, I think I more or less know what's happening there. And we need to be careful, because we at the moment we are still sending these videos through secure email, but emails are not very secure. And so you first of all never include your face, because we don't want this video to fall on these social medias out there. I don't have social media, so you don't have to be worried about me. But so I would prefer them to do it afterwards, because then I can say, look, do it this way. Focus on your left knee a little bit more for me, because it looks like the problem is more localized at the knee. So I think it's better tailored if it's afterwards, after the first visit.
Awesome. Okay, we had a question come in. As an adult with CP, I'm teaching my doctors about me that they have, no answers. They want me to see physical medicine rehab doctors, but only if the few I can find are within 100 miles don't want to see me and just treat kids, or they just treat spine or something specific. What is being done to advance integrative care? This is for you, Dr. Selber. I know it's a big question. We can talk about what the center's doing if you want to get specific, or just general.
Look, this is a very good question. I can tell you as honestly as I can be, we know a lot about children. And we've been testing them and we've been following them for a long time. And we know things that work, things that don't work. In the adult world, if you talk to me 20 years ago and I said that I saw adults, there was only me and a few others around the world that saw adults, and we're still learning a lot about how to treat adults. But I think what the center is trying to do is the right thing. We can only treat patients in this field if we work together. I was trained since the very first day of my training in 1994 that I could never do anything for CP patients by myself. I need to be in what we call a multidisciplinary team. And I think multidisciplinary teams are being fomented more and more and more. And here at the center, that's what we're trying to build. We're building a bunch of people that really have interest in this area, that want to work together, that everybody realizes that no one is better than the other. A patient A may need me more than the other doctor, but the patient C may need the other doctor more than me. And I think that's what is progressing in this field, that we don't work by ourselves. Today I saw 5 patients, and 3 patients I referred them to the neurologist that we work together, because I want to see their opinion. What could we do to improve this or that? I hope I have answered that question.
Yes, I think the multidisciplinary aspect is really key and something that the center does that a lot of other places aren't doing right now, and something that we're really proud of. I think also the research we do at the center is vital for the community. And, I think Dr. Silber, you always say, if something we learn is, a new technology or something you learn is life changing, and you want to share it with other people. And so we're all about that, and working with medical students and residents and getting curriculum to be more CP related, so people know in med school what's going on, and kind of educating from the beginning. So I know the center is working really hard on doing that, as well as our webinars and things that we put out to the community. So thank you for that question. I know it was a lot, but just a few others and then we'll wrap up.
Christina, if I may interrupt you, I saw one question that I think it's very important.
Yes.
Is gait analysis only used to indicate orthopedic surgery? No. In fact, often we use it to not recommend surgery, and because we realize that there's nothing we can do to improve someone's gait. But we also use gait analysis to recommend, for instance, selective dorsal rhizotomy. Is this a good patient for selective dorsal rhizotomy? Is this a good patient for a different type of brace? Is this a good patient for this hip therapy because the patient is so weak in his muscles around the hips? Of course, the amount of gait analysis that we use is related to the resources that we have. And of course, if the insurance company is going to provide it or not. One of my dreams is that one day everybody will have gait analysis before they're treated. And I think Dr. Jim Gage, who taught me gait, it is his dream as well. And that of many others, because there's a lot of centers around the world doing gait analysis, but there's many more that don't use it. So gait analysis is used for a lot of interventions. And the more access we have to the gait lab, the more we use it.
So continuing with the gait lab conversation, we had a question that said, should a gait analysis be redone for an adult? My last one was done by Dr. Root in 2012.
Yeah, we're all big fans of Dr. Leon Root. I admired him so much and I loved him so much. He was one of the nicest giants that I've seen in my life. Well, it depends, because you have to understand that gait analysis is the same way you take an X-ray from your hips to see if you have a problem with your hips. You do gait analysis if you have a problem with your gait. But sometimes we don't need the whole complex gait analysis. We can if the problem is not too complex, we can resolve the problem with video analysis or two-dimensional video analysis. So the same way we don't order blood tests to everyone, we don't order gait analysis to everyone. We want to have gait analysis when we have a complex gait pattern that we're trying to improve, and we're trying to see, okay, what is the best way to improve this person's gait? Okay, remember that gait analysis is not treatment. Gait analysis doesn't treat anyone. Gait analysis just tells us how we're walking. And then we put that data together, and we know how to read that data. And we say, okay, for this patient, we could do this, perhaps we could do that, perhaps we could do that. So the patients come back to us after the gait lab, and we sit down, and sometimes these conversations go on forever. And I say, see, this is what it's showing us. This is what it's showing us. We could perhaps do this, but I don't think we should do that because that brings too much trouble. So I call it surgical or treatment dose. What is the dose for every patient? Well, it's always different.
I'd just like to pop in and say something. I think it's important to note that, like Dr. Selber said, it's not a one size fits all. So it's a great idea to have maybe an initial consultation with Dr. Selber. And we are a very multidisciplinary team. So he might see you and say, no, I don't think a gait analysis is what you need, but maybe you should be seen by our physiatrists, our rehab medicine doctors, or maybe you'd be better off seeing our neurology team. So I think it's a great idea to start with Dr. Selber, since he's the bone guy, right? And say, okay, here's where I'm starting. And now where do I branch off from there? Because I had put in the chat, we really pride ourselves in being whole person focused. So he might say, oh, I see something else. This is not in my scope, but I'm going to find you someone who can address this. So that's why I think that the gait analysis could be great for you, but it might not be. So it's a great idea just to have a consult visit and say, where do I go from here? What next?
Jenny, you couldn't have said it better. I wouldn't have said it better as always. But just to illustrate, I'll tell you this example. The last patient that I just saw before I ran to the screen, she's the most awesome lady. She's a bit older than me. She's Spanish. So we got along pretty well as well because I'm Brazilian and mixed up with everything. And she came to me talking about, she has a hemiplegia. She's 62. And she says, Dr. Selber, I am sick of my left leg because it's getting too stiff. And I examined her again. And I realized that there is no orthopedic surgeon that can fix that. And then I spent most of the consultation trying to tell her that perhaps she should trial some sorts of medications. And she says, no, I'm not going to take the medication. I said, come on, listen, you're Spanish brat. We need to talk about this. And after half an hour discussing medications, she said, okay, I am going to see Dr. Lynn Cadis, who is our specialist in movement disorder, and see what can be done there. I didn't recommend surgery. I didn't recommend gait analysis because I know that that's not the answer to her problem. And this is just a good example that happened just today.
Awesome. Well, I think, we're going over time, and I'm sure everyone is getting Zoom fatigue just in this life we live in now. So again, thank you everyone for joining. If you have any other questions, I'll be sending out an email after this, and you can just respond back to me and I'll get them to the right team member. And this is also going to be recorded, so it'll be on the website and our social media channels if you missed anything or want to share with anyone else. So thank you again, and have a great night.
Thank you.
Thank you all.